continue to wash your hands or sanitize your hands frequently. If you sneeze or cough, do that into your sleeve or elbow, or stay at home if you're not feeling well. I'd also note that playgrounds and play structures remain closed. The same goes for outdoor pools, spray pads, and wading pools. Those will remain closed in accordance with provincial orders until further notice. But thank you for that. Having said it, we do want you to enjoy your weekend, knowing that there are some limitations as you would expect, and we're still compelling people to respond to. Now, despite the fact it's still several months away, I also want to touch on homecoming at Western University. It was announced earlier today that due to the uncertainty of COVID, that this year's homecoming, scheduled for the weekend of October 16th, will take place virtually. Details on Homecoming 2020 and those virtual activities will be announced this summer. It was also announced today, and I think people will find this quite interesting, that Homecoming 2021 will take place the weekend of September, I said that right, September 24th. This date increases the likelihood of the weather and allows for increased participation from students. I applaud Western's President Alan Shepard for his leadership on these announcements, along with the University Students' Council and Western's Alumni Relations. And lastly, I thought listeners would find it interesting that there was a new poll released today by Abacus that found that 77% of Canadians support senior levels of government providing financial assistance and debt relief to municipalities struggling with budget shortfalls due to COVID. And London is no exception. For the last 3 weeks, London and all municipalities across Canada have been calling for decisive national leadership on this issue. And at the same time, we're clear that provinces need to step forward too. This is a national challenge that impacts us all and has to be taken seriously. Cities across Canada cannot wait any longer for emergency operating support from federal and governments. As you know, come August, the City of London is looking at a $33 million shortfall. And that's after making a number of difficult decisions regarding staff, cost containment measures, and reserve funds. You know, in London, we have three sources of revenue from which to operate our essential services. One is property taxes, the second is user fees, and the third is grants from other levels of government. Cities across Canada have appealed to federal and provincial governments for emergency funding. We need this support right now to keep vital services going strong. And Canada and Ontario need us to be ready so that we can drive our collective economic recovery. We're all working flat out to help Londoners through this. We've deferred property taxes. We're sheltering our most vulnerable. We're delivering vital frontline services, fire, ambulance, clean water, transit, and more. We're doing our part for Londoners, and we need the federal and provincial governments to step up. And as I say, we need them to do so now. Thanks, and over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. So I'll go straight to the numbers. Locally, no new cases and no new deaths reported yesterday. We actually saw the total count of cases in the London area reduced by 2 cases over the last 24 hours because 2 cases that had previously tested positive were confirmed to be false positive tests. So these are situations where the test comes back positive, but it doesn't make sense. So immediately the patient's retested, turns out negative, retested again, turns out negative again. So likely the first test was a false positive. So we saw our numbers actually decline for the first time ever for this pandemic yesterday. The provincial numbers are quite a different picture. Provincially, we saw 441 cases reported yesterday, which was more than we have at any time over the past 2 weeks. It continues that gradual upward trend that we've been seeing for a good 2 weeks now. Obviously not what we had hoped to see at this stage. The provincial death count was also significant yesterday. The number of deaths increased in the province by 28. So once again, we're seeing a picture that's somewhat different at the provincial level than locally. Of course, we can't make too much out of one day's data, but those are the trends that we're seeing at this point. A couple of things I'd like to point out today. First of all, we've had questions come in about the use of gloves in public, rubber gloves or latex gloves. And this is something that can potentially play a role. But if somebody believes that by wearing gloves they're completely protecting themselves or others, they actually may be doing a disservice to themselves and others. People who are wearing gloves aren't often washing their hands very frequently, and so you actually may be in a situation where wearing gloves is not just a false sense of security, but also reducing hand washing, which is, as we know, one of the most evidence-based approaches to preventing coronavirus. I can't emphasize enough how important hand washing is. I know it's boring, I know it's what your mom told you to do, and I know it's old news, but hand washing is incredibly important, especially as people start using these personal protective equipment, whether it's gloves or masks. Those can play a role, but not at the expense of hand washing. And if somebody's wearing, a pair of gloves for an entire shift, they're very unlikely to be managing their hand hygiene properly. Gloves are ideal in a situation where you're going to go in and get out. For example, if you're going into a surgery, you put the gloves on, protects you, protects the patient, and then you take them off as soon as you're out of surgery and don't touch anything that's contaminated in the meantime. If somebody's wearing gloves at a supermarket or in another workplace where they're not changing them frequently and they're actually wearing them for long periods without washing their hands at all, those gloves might become a vector of spreading the illness instead of protecting anyone. The other thing I think is important to talk about, the OPP issued an alert today. OPP in the West region, which is most of the area west of the GTA, has responded to 12 overdose incidents in the last 18 days, including 3 fatalities. That's significantly out of line with what you would expect to see over that time period. And so they're issuing an advisory. When we looked at the ACEs data, which looks at emergency department visits for opioid overdose, we don't see that replicated in the emergency department data, but we have had anecdotal reports from some of our partner agencies, Addiction Services Thames Valley, for example, which did identify that they have had reports of deaths in the people that they serve over the last week or so. So very concerning, and just a reminder that coronavirus is just one of the threats that is facing our population right now, and we can't forget about overdoses and other important public health issues. That's it for now, Dan.
All right, thank you, Dr. Mackie. Thank you, Mr. Mayor. We do have 5 questions lined up right now, so let's get to them right away. Dr. Mackie, the first one is for you, and it comes from Carrie McKee at CBC London. Windsor is looking at random testing in the community regardless of whether a person has symptoms. Is London considering a similar step?
So the next step in terms of random testing, so first of all, we have a population sample of everybody in long-term care homes, symptoms or no symptoms. That's an incredibly valuable data set. And what it tells us is how many people in that setting were positive for coronavirus, even though they didn't have symptoms. And the number is very low. In the tens of thousands of tests across long-term care homes that have been completed by public health and partners over the last few weeks, and that's now complete. Basically, everyone living in a long-term care home or staff in a long-term care home has been tested. The people that didn't have symptoms had a positivity rate of 0.2%. So 2 out of 1,000 people were positive. And again, there is a false positive rate. So there's a good chance that a significant number of those were false positives. So that would mean, so if 2 out of 1,000 is 1 in 500, that would mean you would have to test 500 people to find 1 positive case in the long-term care setting. We do need to know what the prevalence of coronavirus is right now in the general population. And so what the Premier announced yesterday around the random testing sample that will be done across the province will be very helpful. It is a sample, it's not testing everyone. And that sample will tell us if we need to go on and test everyone or everyone who's willing to be tested. If we come back with a prevalence rate similar to what's in long-term care homes of, far less than 1% people testing positive in that random sample that the province has announced, that suggests there is not a whole lot of value in going out and testing everyone in the general population, symptoms or not. But if that comes back that the rate is much higher, then that could point us in the direction of recommending more testing for people that don't have symptoms. At this point, the first step is to get a random sample before making that recommendation to the general population.
Thank you for that response, Dr. Mackie. The next question is also for you. It comes from Dan Brown, who is joining us from the London Free Press. Dr. Mackie, are you able to provide more details about London area hospitals' plans to resume non-emergency surgeries that you recently approved?
Yeah, so what I can tell you about the plan to resume surgeries and other procedures and clinics in the hospitals is that it is being designed very carefully and will not be rolled out in a rapid way. The whole approach that the system is taking now is gradual reopening to be certain that we can manage any additional waves of coronavirus activity that happen in our community, as you may be seeing across the province right now. So it isn't something that will open. Healthcare is not going to be bursting the doors open anytime soon. The hospitals would be able to, and that all is still in process. The final details of what will be open when hasn't been approved yet. And I know that the hospitals and the province and others are looking carefully at what's happening right now with the provincial coronavirus numbers in order to make a really well-informed decision about when you'll see some of those services start to operate again.
All right, we have a follow-up question from Dan Brown, Dr. Mackie. There have been ups and downs daily in the number of new cases locally and province-wide as we navigate post-peak slope. Is this variability a concern to you?
So the variability in the local numbers is pretty standard. Essentially, the larger your numbers, the more evenly you're going to see cases distributed day to day. And so if you look actually at the national level, the curve of cases across Canada is pretty smooth because the random variation in the provinces and locally smooths itself out when you average up to the national level. Provincially, the numbers jump around a bit more, and then locally, they jump around a lot more. It's just because we have smaller numbers that you do see more effect of the random variation day to day, so that the numbers look less stable. But really, I mean, we're participating in the same pandemic wave that is affecting all of Ontario and all of Canada. And so that's why it's so important for us to be aware, not just of what our small numbers are telling us, but what the big numbers across the province say as well.
All right. Thank you for that, Dr. Mackie. Mr. Mayor, the next question is for you, and it also comes from Dan Brown at the London Free Press. Mayor Holder, what are you expecting in terms of ticketing and fines this weekend with the park facilities partly open and gorgeous weather in the forecast?
Well, Dan, firstly, I'm optimistic. And the reason I'm optimistic is that last weekend there were no charges laid. Certainly, there were a significant number of warnings in education that we gave to residents. I think with the opening up of the various parks and the amenities that we've announced, that gives some additional flexibility for individuals to be able to utilize benches and picnic tables, and also to take advantage of the fields and courts that are out there in our city. The key, though, that we have stressed is the issues around physical distancing. If people cannot be confident of physical distancing, then we urge them to wear a mask. But I will tell you, the mask is not an alternative to physical distancing. It's just that when you cannot physically distance, then the mask may be appropriate. But at all times, if there are going to be any issues this weekend, it would have to be pretty blatant. Because I want to give a great shout out to our bylaw enforcement folks who have taken great pains over the last 2+ months to ensure that people understood. So look, we had no tickets issued last weekend. I'm confident Londoners will continue to do the right thing. We said in our messaging today, both Dr. Mackie and I have said, and stressed the importance of the physical distancing as part of that process. One of the singular most important things one can do to help the spread of COVID-19. So it's the long way, but importantly stressed way to tell you that I feel pretty good. I want people to enjoy the weather, obviously, to get out and get the physical activity that they should be able to enjoy. At the same time, stay smart, stay safe.
Thank you very much, Mr. Mayor. The next question, Dr. Mackie, Mayor Holder, is for both of you, and it comes from Sawyer Bogdan at Global News Radio, AM 980 CFPL. With the low case numbers today, do you think there is a risk of people letting their guard down? Dr. Mackie, why don't we start with you, and then we'll go to Mayor Holder.
Sure. Well, I think that the reality is we're seeing a wide variation in reaction across the community. Right now, some people are continuing to be very careful. Others have, unfortunately, let their guard down. And you're seeing that play out in some of the numbers locally and provincially. Canadians have been the #1 ally in fighting coronavirus, and the steps that we all took to isolate, close businesses, and be careful, with ourselves and with others. Those are the only reason why we've been able to curb this pandemic. And if we lose the support of Canadians and people start to let their guards down, that's when we'll see this come right back. And that's starting to become very obvious. So yeah, I am concerned, and I absolutely would implore all people in Middlesex and London and beyond to please continue to be vigilant. You are the ones that can curb this pandemic. Your support's been amazing and incredibly effective so far, and we need it to continue.
I'd like to echo Dr. Mackie's comments. I think those are well said. I think there's always a concern that people may let their guard down, and imagine the reasons why. We're going to have probably some of the best weather that we've had in some time. It is a weekend. We have numbers that, by any standard, albeit today, but the numbers that we have seen for the most part for the last number of days has been positive. But we have to remember why they've been positive. They've been positive because people have taken the care that they've needed to take to make sure that they do their part in limiting the potential of the spread. And so when we say that people can enjoy the sports fields and the courts, not as team sports, but as individual things, shooting a hoop, batting a baseball and going chasing after it and bringing it back and batting it out again, what we're trying to do is say, look, everyone's worked so hard, and the numbers may be low, and the rules have been a bit more relaxed for good reason, and I think for justified medical reasons too. But we've all realized how hard it's been, and we don't want to go backward. So let's move forward in a positive and a thoughtful way for each other's sake.
All right, thank you very much, Dr. Mackie. Mayor Holder, we do have, I know there's a member of the media who's joining us for the first time today, and I'm thinking there may be some familiarity challenges. I received a question by email, and it's a question for Dr. Mackie, so I'm going to ask that of you. And if it comes in the question form, we will publish it so everyone can see that afterwards. But the question comes from Jerry Dewan at CTV London. Dr. Mackie, the provincial government is appointing a commission to review the system, and the system here is long-term care facilities. Some have called for a full inquiry. Which approach would you like to see taken, and why?
Yeah, so to be honest, the most important thing for me is that the province is looking at this carefully, and the attention that the Premier is placing on the issue of what's happened in long-term care is well deserved. The people in those facilities deserve that support and attention. I have to admit that I'm not an expert on the different types of reviews and what the implications thereof are. You'd want to go to a political scientist there. But the fact that this has been being considered significant enough in order to warrant a formal investigation, I think is a real positive.
All right, thank you very much. And gentlemen, that completes the questions for this Friday afternoon. I want to thank both of you again for your time, and thank those folks tuning in for being part of the discussion. And we look forward to talking with you again and hearing your questions on Monday when we resume our virtual media briefings. So have a great rest of your Friday. Enjoy the weekend, and we'll see you on Monday.